So some international treaties protect the rights of specific groups, such as children, women, and persons with disabilities. So for example, you can see like a couple of legal instruments that I've put in these slides. The Convention on the Rights of the Child, for example, is a legally binding international treaty. Next slide, please. So through the event today, you will hear us mentioning the term rights-based approach. So what does that mean? A human rights-based approach is a conceptual framework for policies and programs which are normative based on international human rights standards and principles with the aim to promote and protect human rights. So when we talk about a rights-based approach, the United Nations often refer to the panel principles, which are displayed on this slide. So first we have participation, meaning that people should be involved in decision that affects their rights, accountability, an effective monitoring of appropriate laws, policies, but also administrative procedures and mechanisms to secure human rights. Non-discrimination and equality, meaning that all forms of discrimination must be prohibited, prevented, and eliminated, and the most vulnerable, facing the biggest barriers to realizing their rights, should be prioritized. Empowerment, meaning that everybody should understand their rights and be fully supported to take part in developing policy and practices which affect their rights. And lastly, legality, meaning the recognition of rights as legally enforceable entitlements and set out in domestic and international laws. So the purpose of a rights-based approach is really to identify who can contribute to the protection, promotion, and fulfillment of rights, either as duty bearers, such as policymakers or national institutions, or as rights holders, meaning us as individuals and citizens. Next slide, please. The concept of a rights-based approach and rights-based advocacy for nutrition is based on the idea that human rights standards consider malnutrition and inequalities in access to health services as injustices by recognizing health and fundamental rights as interdependent approaches to defining and advancing human well-being. In human rights language, we call the right to nutritious food as the right to adequate food, which was implemented through legally binding international instruments, especially in the International Covenant on Economic, Social, and Cultural Rights, but it also appears on the Convention on the Rights of the Child and the Convention on the Elimination of All Forms of Discrimination against Women. The conditions for the full realization of these rights are provided by general comments and recommendations provided by the United Nations. These are authoritative interpretations as to what is expected of from governments in terms of practical measures of implementation. And in these slides, you can see that there are 5 pillars that are necessary to achieve the right to adequate food. So these are availability, stability, accessibility, sustainability, and adequacy. So the right to adequate food is therefore a cross-cutting concept, including both the right to be free from hunger and the right to access nutritious food. And the right to adequate food has a unique value for advocacy because it provides a general understanding of the main pillars that condition the achievement of stable nutrition outcomes. Next slide, please. So since good nutrition outcomes involve a variety of interventions, for example, sustainable agriculture or access to nutritious food, knowledge of nutrition, and even access to nutrition healthcare, it follows that the realization of the right to adequate food will be linked to the accomplishment of other human rights, including, as you can see in this slide, the right to water, to property, health, information, education, and even the right to be free from discrimination. And as I've mentioned earlier, one set of rights cannot be enjoyed fully without the other. So for the purpose of our event today, let's focus on the links between nutrition and UHC and the purpose of a rights-based approach in this context. Next slide, please. We've learned that good nutrition is essential to achieve a set of different human rights and the highest achievable standard of health. Now, universal health coverage is achieved when all people can use the health services they need from the promotion, prevention, treatment, rehabilitation, and palliation services that are of sufficient quality to be effective and do not expose people to financial hardship. And despite continuous improvements in health outcomes and economic development, rates of malnutrition remain unacceptably high, and progress towards reducing its burden is too slow. Part of the reason for this is that nutrition has not been systematically addressed in health systems. But this gap can be ended by policymakers by implementing policies in accordance with human rights principles in order to remove barriers preventing the people to access nutrition healthcare. So luckily, we have an excellent set of panelists with us today. We will talk about this in more details. So thank you for your kind attention, and back to you, Vinita.
Thank you. Thank you, Matilda. So your presentation sets up the context for us on the rights-based approach for nutrition policy. And I see a lot of comments in the chat as well. Thank you for that. Now I want to invite all the esteemed panelists to turn on their microphones and videos and join me in a fireside chat about this topic. And if, like before, if your video freezes, please feel free to close your video and join with audio. So Lina, I want to go to you first. How can the right to food be translated in policies for tackling malnutrition? If you could share some thoughts.
Thank you. Can you hear me well?
Yes.
Okay. Thank you for that question. And first of all, I want to make a disclaimer that I am not at all a human rights specialist, but it's International Human Rights Day, and I'm also here to learn about it. So I'm also a staff of the World Health Organization working on nutrition and food systems. So first of all, maybe to set the stage, I think we're all aware of the inexcusable prevalences of malnutrition existing in the world today. Over 2 billion people suffer from overweight, obesity. More than 690 million people go to bed hungry. 149 million children under 5 are stunted, and so on and so on. So the right to food of billions of people is violated every day. So why? First of all, secondly, what I want to say is, if people are not well nourished, their health is compromised. And there we already have the link to like food and health. Without good nutrition, there simply is no good health and well-being. And without safe and healthy diets, there is no good nutrition. Now we need food systems, our food systems, to deliver those healthy diets, and they need to be sustainably produced. So all these systems of health systems and food systems are connected. And currently our food systems fail to deliver those healthy diets. In fact, the majority of food systems make us sick. And they make us sick through different pathways. Either we are consuming unhealthy diets because there is a push for the consumption of foods high in sugars, salts, and fats, or because there is industrial animal production that leads to the inappropriate use of antibiotics and leads to antimicrobial resistance. Or food systems lead to chemical contamination and pollution of our soil, our air, our water, and the degradation of the environment, increasing the risk of wild animals getting dangerously closer to humans. And think about this when we think about COVID-19. Food systems also fail to protect the livelihoods of subsistence farmers and food workers. And this also, again, became clear with the current pandemic, and it leads to food and nutrition security. So just again, to highlight that the right to health, the right to safe water, the right to a healthy environment is violated. And the latter, actually, just to mention that last October, the Human Rights Commission adopted this resolution on the right of people to a healthy environment. Now, I want to leave you with 4 recommendations on how the right to food, or more in general, a human rights-based approach can tackle malnutrition. First of all, I think we need to make a human rights-based approach very concrete. I mean, I'm also not a human rights trained person, and the language used is sometimes really difficult. So, but what is relatable are these panel principles that Matilda already referred to: participation, accountability, non-discrimination and equality, empowerment and legality, and that becomes much more concrete. So These principles can be demanded for and can be taken into account in every domain or sector or level we need to work in. Secondly, we have to make noise. We need to make ourselves heard when rights are violated. And I just want to use the example of youth. I mean, their voice is really becoming so strong and loud, whether it's about talking about climate change or demanding sustainable and healthy diets, as they did at the Food Systems Summit. Thirdly, make your point with competence. And actually, this webinar already contributes to it because we need to build the capacities on human rights. Again, I'm very impressed with young people, law students, medical students that fight against NCDs or advocate for universal health coverage. They are so conscious about the injustices. They have the data. They use the existing resolutions to advocate with parliamentarians. So it's really important and to build these capacities. And finally, we have to make good policies that use these human rights-based principles. And there, I just want to mention that WHO, in collaboration with the Karolinska Institute and Uppsala University and the EAT Foundation, is developing a framework called the SHIFT framework to transform food environments through policy action using a human rights lens. Because, I mean, too often the malnutrition problem is framed as, oh, it's a lifestyle problem and people just have to make the right choices. Well, guess what? Many people don't have the choice. So we need to make sure that the food environments are healthy, and we hope that this framework will help in doing this equitably. And that framework should be launched next March 2022. I leave it at that and over to you again.
Thank you, Lena. And like you said, that in the face of malnutrition, there's no health and well-being. And I can speak from my experience as 10 years doing the maternal and child health care in the poorest of the poorest areas in urban slums. The child is brought to you who is like so severely malnourished. For sickness, you cannot cure that with giving a tablet or a medicine or a syrup and say, go home and that's going to take care of it. Thank you for sharing this. I also want to quickly follow up very briefly. You are co-chair of a Food Systems Summit Action Area on universal food access. Can you tell a little bit more on that concept, although you touched on many things, if briefly you can expand on it a little bit more, Lena?
Thank you for that question. I hope I'm unmuted again, that you can hear me. It's great that I can use this webinar to briefly talk about universal food access with a couple of engaged people that I hope are also listening in. We try to plant seeds about universal food access based on the concept that food is not a commodity, but a human right. And we were very happy that the UN Secretary General, in his opening remarks for the Food Systems Summit, really said that. He said, food is not a commodity, it's a human right. So what do we mean by that? The universal food access disrupts the common view on food being just a commodity. So food is a basic human need, like water, like air, that should not be a privilege of those who have money to pay for it. So food should be seen in a more diverse and inclusive way, in three ways, actually. As a human right that we're talking about, that should be protected, fulfilled, and respected, but also as a common good that should be provided through community collective actions and customary food systems. And typically, indigenous food systems do respect that as a food as a common good and share it with their community members. And thirdly, as a public good that should be regulated by the state on behalf of the citizens and provided by the state to the needy, leaving no one behind. I'm thinking of school meals, providing school meals or social protection programs, because still 3 billion people cannot afford a healthy diet. So universal food access promotes this tricentric food governance policy mix. And depending on countries, one could be stronger than the other, but it's like it's about market provision, like based on supply and demand, public provision, and collective provision. So universal food access is inspired also by the universal health coverage and the education for all schemes, which are also being promoted and realized in quite a number of countries. And our dream or our vision is to maybe ultimately have this kind of triple compact, combining universal food access, universal health coverage, and education for all in a universal vital needs compact. So we try to promote this idea. It didn't fly for the Food Systems Summit to establish a coalition, but again, through this webinar, we try to really promote this idea, plant the seed, and hope that it grows to make sure that there is indeed the right to food is fulfilled for all. Over to you.
Thank you, thank you. It's so important, and then we are on it. With this webinar, we are going to have follow-up. We'll talk about it later. So Anne, I want to turn to you. You know, as we know that evidence shows that women and girls are the most affected by the malnutrition, and their empowerment and leadership is also the key to the solution. So I'm wondering if you can talk a little bit about how does integration of nutrition into UHC advance women and girls' rights? Over to you, and anything else that comes to your mind in that regard.
Thanks very much for that, Vinita, and I'm really thrilled to be part of this conversation and representing Nutrition International. So the first thing that I want to say is that really good nutrition really is the foundation for all human development. And then specifically with regard to gender equality, I think it's important to note that good nutrition and gender equality are really mutually reinforcing. And so that it's really critical to improve nutrition to help achieve gender equality and vice versa as well, right? That gender equality can lead to improved nutrition by giving women better access to services, more decision-making power over household resources, and so on. And I think what's important here is that proper nutrition is really the critical ingredient that every person needs to survive and thrive. And it's like a vaccine in a way for lifelong health and well-being. Thanks very much to Lena for really talking about food and food systems and nutrition. But I think it's also important to realize that good nutrition isn't just about access to good quality food. And Vinita, you'll know this well from your work on maternal nutrition, that women and girls have really different nutritional needs at different ages and stages of their lives. And I think pregnancy is a really good example of when women need very particular micronutrients for a healthy pregnancy, for their own health, as well as the health of the baby that they're carrying. And it's often hard to get these just from diet alone, although a good diet is really critical. So if she can get good nutrition counseling, but also micronutrient supplements and other care, weight monitoring and so on, that can help her manage her health during her pregnancy, that's really important. And it's health services that are going to help her get and achieve that good nutrition through her pregnancy. I think at NI, what we want to see is a world in which human rights and women's rights to optimal nutrition through a healthy diet and access to services are fulfilled to enhance her well-being and to help her reach her full potential. But we know in the world that there's a lot of increasing global disparities, and COVID has made this worse, I think. That access to quality health services and vaccines are not equally accessible to everyone within countries and globally. I think it's also important to note that many nutrition interventions or programs sometimes fail to recognize women and girls as rights holders in and of themselves. And so these programs, they'll be maybe described as being for women, but they're really focused on better outcomes for the children that she's expected to bear. And I think we have to be careful about this because it really reinforces a stereotype that womanhood equals motherhood. And this diminishes the role that women play in society, that they could play in society within their family and their communities, and they just simply squash her dreams and aspirations. So for these reasons, universal health coverage remains an important, or primary health care remains an important delivery channel or platform for nutrition interventions. And UHC, I think, can then help become a route to equity and equality in action. And that's why this conversation, I think, is so important when we're talking about gender equality and nutrition. As well, I want to say that if we can implement universal health coverage, or UHC, through a rights-based lens, we have an opportunity to put women in the driver's seat. We can give, it gives her the permission to demand services that can be provided on her own terms at times when she's not working, by qualified staff, by people who treat her with dignity. And it also obligates duty bearers to make sure that services are provided in a non-discriminatory way, as we heard Mitchell describe in her framing of rights. So that, I think, is extremely important. So let me leave it there, Vanita, and let you continue with the conversation. Thanks very much.
Thank you. Thank you. And I really like how you put it, and I hope people captured so many nuggets in your response, that one is that nutrition is like a vaccine for lifelong health and well-being. And then often as a gynecologist and obstetrician and an advocate, it comes to me like women's rights are human rights. They cannot be treated just as vessels, right, for carrying the child, although maternal role is very, very crucial, but they are more than mothers. So thank you, Anne, for that. And I'll come back to you in a minute. I want to go to Lisa next. Lisa, which human right do you think should be leveraged, and which intervention should be prioritized to ensure a holistic approach in implementing UHC, including prevention and treatment of malnutrition? Over to you, Lisa. Lisa, I can't hear you. I think you're on mute. Still no voice. You're still on. Yeah.
Okay. I think hopefully you can hear me now.
Yes. Yes.
Sorry,
yes.
the host had to unmute me. Yeah. So in terms of which human right should be prioritized or leveraged on to achieve holistic UHC, I'd say, I mean, it seems straightforward, but it really isn't. It's more, of course, the right to the highest attainable standard of health. And this is obviously for a couple of reasons. So first, having that recognition of the right to health as the driver of UHC allows the design of UHC to actually think of the what, or rather the essential elements of health, and how, or the essential elements of the right to health, and how those can be captured within any design and implementation of UHC. So thinking of availability of services, whatever these services are, accessibility being physical accessibility, economic accessibility, which is that, affordability, which is one of the main reasons that we advocate for UHC. Having acceptability, I think touching on some of the things that Anne has said around non-discrimination. So are the services being provided in a way that is dignified? And for, as Anne said in the example of a woman, are you being treated as a vessel, or are you being treated as a human being that is accessing a service? Are they quality services? So that's one of the, another reason, aside from understanding the essential elements, is now the recognition of the underlying determinants of the right to health. So this is, as both, in fact, as Mathilde, Lina, and Anne have pointed out, rights do not operate in isolation, and things like food and health are mutually reinforcing. And so this is understood at the global level, that there are determinants that, without, let's say, adequate food, without safe food, without sanitation, without safe drinking water, without health information and education, reaching the highest attainable standard of health becomes quite hard. Like all these things operate towards, boosting an individual towards reaching or realizing that right. And even if you think in the instance, practically speaking, in the instance where a country, as many countries do not constitutionally or legally recognize the right to food, then leveraging on the right to health and thus leveraging on adequate nutrition as an underlying determinant for the right to health gives a great foundation to advocate for integration of prevention and treatment of malnutrition in the health system. I think the third reason that the right to health should be the driver of UHC is that there are already recognized pathways towards having a strong health system and therefore comprehensive and holistic universal health coverage. So approaching, and now even to be specific on prevention and treatment of malnutrition, if you think through it in terms of the 6 pillars of the health, of strengthening health systems, or the 6 pillars of strong health systems, it can clarify the pathways to use and how nutrition and nutrition-related actions can be integrated. So if you think of the 6, like governance and leadership, that's already a basis for ensuring that UHC plans and policies integrate nutrition and are actually aligned with any national, regional, global, multisectoral nutrition plans. It also includes now integrating nutrition-related actions in health services as part of the national health system. If you think about the health workforce, we're thinking about training on integrated delivery of nutrition interventions, and training, of course, again, alluding to what Anne said, training of thinking about nutrition and prevention and treatment of malnutrition beyond early childhood nutrition, antenatal care, and pre-antenatal and postnatal care. So having a more comprehensive view of what nutrition interventions would look like throughout the life cycle of a human being. In health service delivery, of course, having actual essential nutrition actions within the health systems. And that's, of course, dependent on the priorities of the countries themselves, having access to nutrition-related health products. A key one, financing, and I can see as someone from, of course, the global South, Kenya, meaning that someone who lives, in a health system that is primarily financed by donor financing, having this constant push towards increased domestic allocation of resources towards nutritional action is beneficial for me because it is more sustainable and not dependent on whether my country will be reclassified and thus have less access to donor resources. And lastly, of course, there's the health information systems. So how are we educating? So we talk about, and I think Lena alluded to this as well, around the personal responsibility argument that nutrition is really about individual choices, while our external environment is constantly, we're constantly fed information or messaging that actually leads us to make unhealthy food choices or leads to bad nutritional choices. So think about the effects that marketing of unhealthy foods has on the choices that we make, the placing that putting sweets right at the counter in the supermarket, those sort of external influences, having that recognized and then channeled through health information systems could help individuals be more discerning around, the environment. So not necessarily putting the responsibility on the individual, but giving the individual the tools to understand how external influences are affecting their food decisions.
That's fantastic, Lisa, and so true. I mean, there's a role for individual responsibility, definitely role for philanthropic efforts, but the crucial point is the human rights approach to nutrition. Mm-hmm. It's a right. It shouldn't become a privilege. So thank you for lots of very important information and thoughts that you share. Let's now turn on to some consideration on the implementation side. I'm turning to Honorable Bernie Nemeth. As a member of the Parliament of Cote d'Ivoire, what can you tell us about plans and efforts to ensure monitoring of the progress on policy commitments, reflecting on your country? over to you.
Merci, Madame. Si je me fais bien attendre, je suis très heureux vraiment de représenter la Côte d'Ivoire, mon pays, à ce sommet, donc ici à cette rencontre parallèle du sommet L4G, donc ici à Tokyo 2021. Alors, vous me demandez, donc je voulais profiter également pour saluer tous les panélistes et vous également. Donc, vous me demandez qu'est-ce qui est prévu ici en Côte d'Ivoire pour s'assurer qu'il y a des études pour surveiller les progrès sur les engagements politiques. Alors, il faut retenir que la question des études de surveillance constitue le talon d'Achille de la politique du gouvernement ivoirien pour faire progresser ses engagements en faveur de la nutrition. Nous constatons malheureusement ici un faible niveau de suivi des engagements donc ici pris par le gouvernement ivoirien. Alors, tout récemment, il y a un mois de cela, lors de la réunion de revue des engagements N4G, en novembre dernier, le gouvernement ivoirien, à travers le Conseil national de nutrition, l'alimentation et le développement de la petite enfance, en abrégé CONAP, une structure initiée par la primature chargée de la coordination multisectorielle de la nutrition, a dégagé des axes prioritaires. Donc, nous pouvons vous en donner deux axes prioritaires, à savoir la raison d'enquête régulière et la collecte et la centralisation donc, des données sur la nutrition. Ça, c'est le mois dernier. Et un mois après, donc tout récemment, lors donc ici du sommet N4G de Tokyo, notre pays, la Côte d'Ivoire, a réaffirmé cet engagement, qui consiste donc ici à sa volonté à axer, à mettre l'accent sur donc ici le suivi de ces engagements. Et cela à travers donc notre représentant, qui est le secrétaire donc ici de la présidence, le ministre Abdelrahman Cissé, qui a donc ici réaffirmé l'engagement de l'État ivoirien à maintenir la contribution au programme multisectoriel donc de la nutrition à hauteur de 15%. Il a rappelé également que notre pays fait donc ici des efforts pour donc ici mettre l'accent sur la collecte et la gestion donc ici des données sur la nutrition. Alors, Madame, ici en Côte d'Ivoire, le manque d'études, ça c'est ce que j'ai dit tout à l'heure, le manque d'études réalisées régulièrement entache quelque peu les nombreux efforts du gouvernement ivoirien et de toutes les structures sur place qui œuvrent inlassablement donc ici à faire progresser les engagements ivoiriens en faveur donc ici de la nutrition. Mais toutefois, des efforts ont été faits par le passé. Je voulais rappeler déjà qu'en 2018, mai 2018, l'État ivoirien a pris un décret qui rend donc ici obligatoire l'enrichissement du sel en iode destiné à la consommation humaine et animale, afin donc ici de parvenir à éliminer les troubles dus à la carence en iode. Cependant, il faut noter que la dernière étude démontrant la prévalence de la carence en iode ici en Côte d'Ivoire date de 2004. Vous voyez, de 2018, le dégât a été pris, nous sommes en 2004. Ce qui explique donc la difficulté que nous avons ici en Côte d'Ivoire à donc ici évaluer l'impact de ce décret sur donc, les engagements pris en faveur de la nutrition sur cet aspect. Et donc, c'est dans cette optique, afin donc ici d'actualiser nos données et donc ici évaluer cet impact-là, le CONAP a prévu donc ici de commanditer une étude en 2022 afin donc de mesurer donc, cet impact-là. Alors, il faut dire également que pour garantir une coordination plus efficiente et ainsi que la disponibilité de résultats d'études avant les échéances, donc ici, de ce qu'on appelait en anglais le World Health Assembly, donc de la santé, prévu en 2023, et donc ici, les objectifs de développement durable à 2030. Le CONAP, qui est donc ici le Conseil national de la nutrition, de l'alimentation et devant la petite enfance, agira en tant que mécanisme de coordination entre les différents organismes chargés donc ici de mener les études et établira donc ici un plan de répartition des études et d'enquêtes. Sur cette question, Madame, vraiment, c'est ce que nous pouvons retenir. Des efforts sont faits en Côte d'Ivoire, mais sauf que l'absence d'études et donc ici d'enquête, donc ici évaluer l'ensemble des mesures prises fait un peu défaut. Et donc pour nous, avec ce qui a été pris comme engagement pour 2022, 2023 et 2030, on aura vraiment des données statistiques qui nous permettent aussi d'évaluer la politique qui va faire progresser la nutrition ici en Côte d'Ivoire. Cette question, je voulais vraiment encore vous dire merci et dire encore que je suis donc ici à votre écoute.
Thank you so much. And we apologize for the little bit of confusion between the transition. That's, you know, we roll with it. That's a Zoom meeting for us. Thank you so much. And I'm going to ask, get back to Anne, to you again. The majority of the global health workforce, and in particularly frontline health workers at the community level are women, right? How can women drive change and integration of the nutrition within primary health care? It's just expanding on, you already talked a bit about it. So just expanding on it, how can women drive change in integration of nutrition within primary health care as frontline health workers or otherwise, whichever way?
Thanks very much for that, Vanita. The first thing that I want to say is that achieving universal health coverage by definition demands that we reach every household in every far-flung community. And I think really frontline health workers are the face of this care. And as you just mentioned, these are mostly women in all places in the world, I think. The other thing that I want to start off by saying is that the pandemic, COVID-19, has really highlighted how important these community health workers are as the face of primary health care. You know, we saw, especially in the early days of the pandemic, when facilities closed and travel ceased, when it was impossible to get on a bus or find a taxi or move from one place to another, really for many women, the only source of health care was their local community health worker or a local nurse. And in some countries, even without COVID, travel is really restricted because of different gender norms in that country. So in Pakistan, where women really, in some parts of the country, can't move around so well, we know that lady health workers are instrumental in delivering care directly to women in their homes. This is super important to ensure that women get the care that they need when they need it. Nutrition can't wait. It can't wait for somebody's pregnancy to be over just because of a pandemic. And we really need to ensure that women get these services at the right time and in a place that they can access. And as I said, community health workers are really the face of this. But to do this job well, you know, we need to ensure these health workers have the right training, they have the right skills. And that when we provide them with these skills and training, that in turn boosts their confidence and their ability to do their job well. So the other thing that I want to say about health workers is that the women who do these jobs, these frontline jobs, they really largely do it because of that they believe in it, that they want to care for their community members, for their neighbors, and that most of them are really unpaid or poorly paid. They don't have any kind of career path. They're not often considered part of the formal health sector. They really have no employment rights at all. And I think this really has to change. And I think that UHC really demands a certain quality of basic healthcare, of primary healthcare. and that we value this and that it has a value. And that means that we should really pay those who deliver it. And we should ensure that they have a basic set of benefits, that they're trained properly, that they're a formal part of that important workforce. So in 2020, last year, despite the challenges of COVID, NI supported training on maternal nutrition for almost 50,000 frontline healthcare workers, and over 70% of those that we trained were women. But we also supported a lot of training for health facility managers. And when I look at the sex disaggregated data and the reports that I get from my country teams, these are mostly men. And that's something else I think that has to change, that we need a lot more women in leadership roles to help create the changes that we want to see in terms of the way services are provided. And I think if women were to take on some of these management roles within healthcare, they could advocate for some of these changes and really help to understand what those changes need to be. And maybe the last thing that I want to say, Benita, if you could just give me a couple more minutes, is that it's not just women in the health sector that can help with transformative change. And I think women leaders in other areas are also really important. Another piece of work that NI did in Tanzania was to work with women parliamentarians in a women's parliamentary group. And we were able to sensitize them on nutrition issues, on the importance of primary health care and nutrition, and the importance of delivering that with the rights-based approach, with the right quality, with dignity, and ensuring access. And this really can help drive policy change, and again, help us get to universal health coverage. So let me leave it there, Benita, but thanks very much for the question.
Thank you. Women for leadership at every level. That's what we need. Thank you for that. And I apologize to the panelists because we were a couple of questions were left, but in interest of time, because we want participants to have the ability to a little bit synthesize the information. So let's segue into our break room discussions. We invite the audience to join in the discussions about these recommendations. So how we are going to do is that you will be automatically sorted out to go into the break rooms. But people who need translation or the French, who want to stay in the French room, they should stay and reject the sorting out that they are pushed into other break rooms. So stay in the main room with English and French interpretation. Thank you so much, because we will be providing the French interpretation in the main room. So please do not leave the main room if you need that interpretation. Thank you. And see you in a quick break afterwards. I mean, not break, but after the break rooms. Let's go.
Okay, hi everyone. So I think we're going to get started with the breakout room in there. So we are now going to have a conversation on rights-based policy recommendations to tackle malnutrition and on integrated nutrition in UHC. So I'm going to put a link in the chat to Jamboard, so you will find that the two questions that we're going to answer. And I'm going to share my screen in a minute. Can someone please confirm that you're seeing my screen? Okay. It's a bit difficult for me to see the participants in the breakout room. Can someone confirm that you are seeing my screen, please?
We see it.
Thank you, Sabina.
Oh, and I'm going to allow everybody to be able to unmute. Okay, so we can actually have a conversation. There you go.
Thank you, Sabina. First, may I ask anyone in this breakout room, please, anyone to volunteer for being the reporter when we are going to give feedbacks at the end of this discussion. So we are going to share feedbacks in plenary rooms. So may I have a volunteer, please? Otherwise, I will just pick someone. Do we have a volunteer from participants? No? Okay, so I'm gonna pick someone. Annie Castillo, sorry to put you on the spot. Would you be able to be our reporter for this breakout room session, please? Annie, can you hear me? No? Okay. Okay, so moving on to the conversation. So we're going to answer the two questions that you can see on the screen. So the first one is, what policy recommendations would you make to ensure progress on the N4G commitments that is, I'm going to show on the next page, and which human rights should be involved? The next question is, how would you integrate a human rights-based approach in your advocacy, and who needs to be involved? So to answer the first questions, so please go on the second page of the Jamboard. So you can see there a commitment that has been made this week from Brazil. Brazil committed to implement healthier nutrition environment for adolescents and include nutrition in primary healthcare. So if you have any policy recommendation that you think should ensure progress for this N4G commitments, please can you type your answer either in the sticky note or either use the chat box on Zoom, and I will be able to put it there myself. So does anyone have any thoughts for progressing on these N4G commitments? Any idea? Oh, I can't see the chat box. Sabina, if you're there, do you see any thoughts on the chat box? Sabina is not here. So for example, I see someone is in between.
I'm not on the chat box. I can, unfortunately, I can't type into the chat box. But I think in terms of policy recommendations, I'm from Africa and I work with a lot of African countries. They have policies exist. It's how to ensure that those policies are acted upon. That seems for me the major problem, that there are policies on paper. How do we move from paper to action? Thank you.
Yeah, that's a very good point for progressing on this commitment. Thank you very much for sharing. Does anyone want to follow up on that? Or do you have another idea for making progress on Brazil's commitments? So for implementing healthier nutrition environment for adolescents, there are a couple of interventions that we can think about. So especially for adolescents, so I'm imagining quality school meals or nutrition education could be a way of progressing on these commitments. Does anyone want to expand on this one or have a different idea or agrees?
To your previous point, there are 2 comments in the chat. Iron tablet supplementations to adolescent girls in National Health Program. The second one is, I think it depends about the places and society, local. For example, nowadays the influence have lots of impact on the young people.
Thank you for sharing. So unfortunately, I can't see the chat box as I'm sharing my screen. Hold on. So I'm going to stop sharing for a second.
You can enable the chat box in a pop-out window in the menu for in the screen share.
Everybody?
Yes.
But, maybe Hannah, can you share what pops up in the chat? Can you share that in our WhatsApp?
Yes, sure.
Okay. Vous demandez comment faire donc ici améliorer la nutrition donc ici de l'adolescent. Nous avons en Côte d'Ivoire une expérience comme nous sommes dans un pays qui est un monde avec un point de développement. Il y a des soutiens aux cantines scolaires. C'est-à-dire, qu'est-ce que ça se fait dans les élèves? Comme l'État n'a pas trop de moyens pour soutenir l'éducation en milieu scolaire, il y a des ONG qui apportent du soutien aux coopératives agricoles villageoises. C'est-à-dire, on a donc des semences de produits et donc ici, on les encourage à produire donc ici la nourriture. Et ces nourritures sont donc ici reversées à l'école et chaque jour, elles sont vendues donc ici effectivement contributif. Les élèves payent 50 francs, par exemple, 50 francs, qui peuvent ici relancer l'activité agricole. Donc, c'est une contribution des parents d'élèves à alimenter ou à nourrir les plus défavorisés qui viennent à l'école par le travail. On fait participer donc ici les gens à travailler. En retour, on récupère la nourriture pour les vendre donc ici dans les cantines scolaires au village. Et ça permet vraiment d'améliorer la qualité de la nourriture. Il y a des jeunes filles qui sont formées, qu'on les forme à préparer donc ici, sur donc ici l'éducation. Et vraiment, ça aide beaucoup. Je pense que le soutien à ce niveau, et tout n'est pas l'État, mais les initiatives privées à ce sens-là aident beaucoup aux gens vraiment à avoir la nourriture des enfants. Merci.
Merci beaucoup. Thank you for this remark. Does anyone have a follow-up remark if you have been able to understand this via the interpreter? And do you have some thoughts about how including nutrition in primary healthcare, any type of intervention that you think is necessary to make progress on this commitment? I'm thinking about, for example, any type of interventions for preventing against anemia for the adolescent girls. Does anyone want to expand on that or have a different idea? And regarding human rights to progress for achieving this commitment, so if we go on the next page on the Jamboard, so you will recognize the slide that I've been sharing in my presentation at the beginning of this event. Between all of these rights, and of course this is not an exhaustive list, the right to adequate food is not mentioned in this paper. Is there any particular right that you think we should make progress on for achieving Brazil commitments? So for example, we talked about nutrition education. Which one do you think is important to progress on to achieve this one? Thank you for the translation. No guess from no one? So how about the right to education? How important do you think the right to education is for progressing on having a healthy environment, nutrition environments for adolescents?
Ok. En ce qui me concerne, au niveau local, on devait déjà instituer, je dirais, l'éducation à la nutrition dans les formations scolaires et universitaires. Pourquoi même pas créer une filière spéciale en nutrition? Vous voyez, de sorte à avoir des spécialistes en nutrition, donc ici, qui sont donc auprès des sages-femmes, des pédiatres, des infirmières. Ça, je vois, c'est au niveau donc ici l'engagement de l'État. Mais pour ce qui est du droit humain très valorisé, moi, je dirais que déjà, il y a le droit à l'alimentation qui est déjà donc ici pris et à l'ordre du Pacte international des droits socio-économiques et culturels. Mais je pense que c'est un ensemble qui est très vaste dans lequel on ne peut pas donc spécifier notre approche de la nutrition. Moi, je demandais donc au gouvernement, donc aux décideurs, aux ONG qui militent en faveur des droits de l'homme, de créer un protocole additionnel ici, de sorte à avoir un test spécifique vraiment sur la nutrition. Le droit à la nutrition, on retire donc ce droit à l'alimentation. Je pense que cette question, il y a donc ici une obligation, donc ici en interne des États, donc ici à intégrer ce nouveau droit-là vraiment dans les politiques, de nutrition. Je crois que c'est ce droit-là vraiment qu'on peut donc ici valoriser. Je vous remercie.
Oui, merci. Je suis parfaitement d'accord avec les remarques que vous avez faites. I really agree with the remarks you've just made. Thank you very much for sharing. And to follow up on that, so sorry, we don't have that much time for the last question, but I would like to ask you, how would you integrate a human rights-based approach in your advocacy and who needs to be involved? And is a human rights-based approach relevant for your advocacy at all? So I'd like to have this conversation. Please type your sticky notes if you want to answer that question, or unmute yourself and go ahead.
I actually, and thank you for that question. I think one of your colleagues earlier talked about involving the young people themselves. When we are talking adolescents, I think the sexual and reproductive health group are making a lot of progress by just involving the adolescents themselves to voice what their needs in terms of nutrition and nutrition policies and what that should look like in their definition to push for that policy. And I also think that nutrition, the whole area of nutrition is very, very broad. And you need a multisectoral approach at all levels, completely, right from the top to the community level. You need to be very engaging. You need a multisectoral approach, not just a kind of a vertical approach, but a well-coordinated multisectoral approach. Thank you.
Thank you for this remark. And yes, completely agree with that. It should be at all levels and starting from individuals so they can participate, take decisions and participate in decisions that affect their rights. Completely agree. Is Sabina here? Do we still have time for answering the second question, or is it time up? No, okay. So how about others? How human rights-based approach will be important for your advocacy or for your work? And do you have idea of other sectors that should be also involved to support us, in implementing rights-based approach to nutrition? Any other sectors? So for example, yeah, do you have any idea?
Alors, chez nous, en Côte d'Ivoire, et comme nous le constatons, la question donc ici, la malnutrition concerne la couche sociale, je dirais, en milieu rural la majorité. Alors, c'est un milieu où beaucoup pensent que la question des droits humains, c'est une question qui relève du privilège, du prestige, que c'est une affaire de ceux qui sont riches, c'est une affaire de ceux qui sont en ville et qu'ils n'en ont rien à foutre. Donc, je pense qu'il faut vraiment donc ici intégrer ou bien inclure ces personnes-là qui sont elles-mêmes victimes de la malnutrition, mais qui ne se rendent pas compte que c'est un droit pour eux de bien se nourrir. Parce que pour eux, cette question de droits humains, c'est une affaire donc ici de l'Occident, l'affaire des Blancs, et que vraiment les expliquant, vraiment, ils ne trouvent pas là vraiment un sens vraiment à écouter. Alors que, en leur expliquant le bien fondé, ils ont droit à être bien nourris et vraiment de façon progressive. Et même là, nous prenons en compte les conseils pratiques de ce que l'on donne. Et également, ils sont les populations qui sont donc ici victimes de la malnutrition, pour la plupart, sont très récalcitrantes donc ici au conseil des sages-femmes pédiatres. Parce que je vous donne l'exemple, on leur dit l'allaitement, c'est 6 mois, et je crois il y a 2 mois déjà, on avait la nourriture normale aux enfants. Et donc, ici, vraiment, c'est un problème sérieux. Donc, nous qui avons vraiment une population rurale en majorité pauvre, démunie, qui n'a pas donc ce qu'il faut, je pense que c'est cette population-là qu'il faut intégrer à travers nos canaux traditionnels de communication, l'église, la communauté villageoise, les impliquer pour faire de ça vraiment un droit fondamental, un droit vraiment à promouvoir. Je vous remercie.
Sorry.
Go ahead, Sabina.
And I think the other sector that we need to when we are talking about nutrition is the private sector. The private sector for profits, the people that advertise Coca-Cola in a very nice way, or foods that really don't contribute that much to good nutrition. I think we need to bring them into the table. We need to bring them as partners in advocacy, also advocate to them.
Yes, this is very important also, like to make sure that the private sector is also involved to answering those challenges and respecting human rights of everybody for having the right to good nutritious food. Really agree. Sabina, did you want to jump in? I see you have your hand raised. No. Okay, and thanks for the remarks previously said. So for those who didn't have French interpretation, sorry about this. We heard about the necessity of including all the community to be involved in all the question on how to improve nutrition, and for them to really own the response and the response made by policymakers, and including religious leaders as well, and traditional chef leaders, if I translate correctly, is also necessary for achieving this goal. Do we have any other remark, or is anyone okay to volunteer for doing the reporting in the feedback plenary session? I can do it myself if we don't have a volunteer, no worries, but does anyone want to volunteer? thanks, Annie, for your remark. I'm going to put that in the chat box, that every sector of the society, moms, doctors, social foundations, should be involved. Yes, I'm going to put that in the sticky note.
Okay, I'm going to close the breakout rooms, just a 10-second warning.
Okay, thank you, Sabina. And thanks everybody for your thoughts on these two questions. So we have a lot to feedback on, and thank you for taking part of this in this conversation.
We'll give a minute to get people back into the main room. Okay, I think we are all back. Welcome back from the break rooms. In our break room, we had great discussion, and I hope other break rooms had great discussion as well. So here's what we're going to use a few minutes left. We are going to take a group photo. If we were in person, we would hug each other, stand in a row. I remember those days finding steps to stagger so everybody could be squished into the picture. But what we are going to do today is just, if you're comfortable, switch on your video so we can take a really good picture. So that's one thing we are going to do. And then we are going to do a little exercise in a couple of minutes before we say goodbyes. So let's take a Zoom picture here. Please cue us, person who's taking the picture.
Great, I'll give people another second to turn your cameras on if you want, and then I'll count down.
Thank you, thank you.
All right, 3, 2, 1, and keep your smiles. And I'll do one more just to be safe.
Yeah.
Just give me 1 second.
Should we do a fun one too, Dorothy?
Yeah, sure. Should we do one fun one right now? Anyone has kind of a silly face or anything? Great, we've got it. Thanks, everyone.
Awesome. Thank you everyone for indulging us in that. So what we're going to do is put the Jamboard. We had hoped that we will bring the presenters to share key points, but we want to finish in time or a few minutes early. So we're going to link the Jamboards in the chat, and we will also share with the participant later on with the email so that people can see what discussions happened in the Jamboard. And, you know, we should keep this conversation going through the Twitter. You have all the panelists' Twitters. Please tag each other, tag your organization. My Twitter is Gupta Vinita, Gupta. WINEETA. Tag me as well, and action _ tweets, and we will make sure that we are retweeting and sharing your tweets further. So now what we want to do is a little quick exercise. If people can use the chat, I know that not all of us had a chance to talk. See if they can use 1 or 2 words about how they feel, what they learned, whichever way direction you want to go, what you learned, or what you're feeling, or what's your big pitch for HR, human rights, whichever it is. If you can use the chat to just burn the chat up. So write all those words into the chat. We'll give a quick minute for people to do that. I hope to see everybody in the chat's comments box. Is the chat burning up?
Yeah. I see Lena stole from Pat, from aspiration to obligation.
Awesome. We want to hear from everybody, please. I know we are still 30 people in the room, so please do. Lisa, please tag Lisa and Calvin Kenya in your Twitter as well.
I stole aspiration to obligation from Dominic Mascore, the head of Concern Worldwide, yesterday at Nutrition for Growth.
Awesome. So I want to thank you all for being part of this conversation. Everyone, advocates, policymakers, civil servants, and others have a role in ensuring rights-based policies are enacted that will help tackle malnutrition and keep commitment makers accountable for their N4G pledges. We had great discussion today. I know I have learned a lot listening to the panelists and the questions in the chat. So I'm going to take that in my advocacy. Each one of us can play a role in helping to ensure that human rights are integrated in a more meaningful way at N4G 2024. And I know we are conspiring at Action Partnership. So we want you to be co-conspirator, collaborator in conspiring to make that effort gain more momentum for N4G 2024. And you will be hearing from us about that through our Twitter, through emails, through other sharing, that how we want to move forward with it. Maybe have a petition where all of us say, yes, we need human rights integrated more meaningfully in the next N4G. And we will share the recording and the blog post highlighting the key takeaways very soon. Please stay tuned. Please share your thoughts, as mentioned before, via social media, blog post, and take a moment. We encourage all of you to please take a moment and fill this sentence through any way means you communicate with the larger community. Nutrition is a human rights because, and then you put your own thoughts there, why it is. Again, nutrition is a human rights because, and please do share through Twitter, tag us so we can harness all the ideas that you share and also amplify your message. You'll also see it link, digital toolkit, linked there with images that can be shared on the Twitter or other platforms. Big shout out. And I also do not want to finish without giving a big shout out to the behind the scene, hardworking organizers here, Sabina, Mathilde, Dorothy, and Dede, and Hannah. You have done incredible job for putting this event together. And if you can, put some sign on your Zoom thing so that people know who you are. Thank you, thank you, thank you. I know that how much hard work went into it. And thank you to amazing, amazing participants and incredible panel. Thank you. You were able to unmute yourself now and say hi or goodbye. Linger on. It's like we used to have old times when the meeting ends or the panelist ends, we still chatted. So please feel free to take a few minutes to recreate that in a Zoom room. And I wish you a great rest of your day. And once again, don't forget to engage with us. Thank you, thank you, thank you.
Thank you, everybody, so much.
Thanks a lot, Vanita.
Thank you
all.
all. Thanks, everyone, and happy Human Rights Day.
Thanks for an amazing session.
Happy
Truly.
Human Rights
Human
Day.
Rights Day. It was informative and interesting.
See you all on Twitter.
Yes, see you on Twitter, everybody.
Ok, merci également. Merci. Voilà.